This video's aim is to help if you are suffering with shoulder impingement syndrome. Shoulder impingement syndrome is a very common shoulder problem. It occurs when the tendons of the rotator cuff become inflamed and pinch between the bones of the shoulder. This causes pain, especially when the arm is above the head. It usually occurs between the ages of 45 and 65 years old. But it can occur in younger people, especially if you play a lot of sports which involve overhead movement, such as tennis, repetitive throwing or swimming. The painful arc is something associated with shoulder impingement syndrome. This is when you get pain between this point and this point of movement when lifting your arm up. Symptoms. Pain is usually at the front or side of your shoulder. You get discomfort when moving the arm, especially with overhead activities. Sometimes the shoulder will feel warm and you can get an aching down your arm. It can give an occasional sharp pain in certain ranges of movement. Diagnosis. Your GP or ideally a physiotherapist are best placed to diagnose the problem. What should you do? Avoid any aggravating movements, for example repetitive overhead movements. Apply ice over the shoulder. Always wrap the ice in a towel to avoid an ice burn. Take a course of anti-inflammatories unless you have been advised not to by your GP. Painkillers will help control pain until it subsides. Take advice from your pharmacist. Maintain a good posture when you are sitting and standing. This shows how to sit properly. A physiotherapist can help to put a tailored exercise program together for you. However, here are some exercises that might help. Scapular setting against the wall. This exercise can help to improve your posture. Stand with your back against the wall so that your head and bottom are in contact with the wall. Keeping your arms relaxed by your sides, squeeze your shoulder blades together and slightly down, without losing any contact with the wall. The wall should help you to feel the correct movement. Hold the squeeze for 10 seconds and repeat 5 times. Repeat this little and often throughout the day. Pec stretches. In the corner of a room, face the corner and take your arms out to the sides so that your shoulders are at 90 degrees. Now bend your elbows to 90 degrees and lean your forearms onto the walls. Now allow your body to move forwards and past your forearm position until you feel a stretch in your chest. Hold here for 30 seconds and repeat little and often throughout the day. Rotator cuff strengthening, isometric. Stand side on to a wall so that your right shoulder is touching it. Bend your elbow to 90 degrees so the top of your hand is pressing against the wall. Now push into the wall with your hand and hold with moderate pressure for 30 seconds, then relax for 10 seconds and repeat twice. Then swap arms and repeat if needed. Do this exercise 3 times a day. If you get worsening symptoms or are unsure, then initially reduce the push into the discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. After several days, you should hopefully notice increased flexibility and possibly reduced pain generally. Remember, injuries take time to recover and do so gradually, especially the shoulder, so be patient, there are no miracle cures.